Hello, my name is Mark. Let me review this question with Kenneth and Jennifer. As a nurse, you noticed that one of your colleagues has been coming late to work lately and often disheveled. In one of the night shifts, she arrived the floor very late when the day staff that was supposed to give her report had gone, and she was apparently drunk. She headed straight to the medication room and drew up insulin to medicate one of her patients. What will you do immediately?
Right, let us look at the options. Option 1, report to supervisor. This is wrong. You cannot just report to the supervisor because somebody's safety is at stake here. Therefore, reporting to a supervisor is not the immediate thing you do. You can do that later, but not now. Number 2 states, wait until after the close of work and then you talk to the nurse in privacy. We are talking about somebody that is drunk. You don't want to allow the person to go and give this patient overdose of insulin, and then the person will probably pass out, and then only for you to go and talk to her at the end of the shift. So option 2 is inappropriate. So you need to do something more urgent. Number 3 said document the finding. This is wrong too. I know for every incident that happens, you have to document it in order to protect your license and then to protect your job. But documenting the incident here is not the immediate thing you should do. Remember, the question is, what should you do immediately? So because of that, option 3 is also wrong. Let's look at option number 5. Number 5 said, tell the patient not to allow the nurse to take care of him because the nurse is wrong. This is wrong. It's not something you want to do in a hospital setting. It has both legal and ethical implications. You don't want to drag your hospital in the mud by telling patients that. And the patient might just hold on to it and probably sue the hospital for employing people who are drunk to take care of patients. Then number 4 said, challenge the nurse and take over the insulin administration. This is the right thing you should do. So the correct answer is option number 4. By challenge, we don't mean that you should go and fight. You might just say, hey, I can help you do this now, and then you can talk about it later. Because this person is drunk. You don't want her to go and kill this patient. So whenever board give you questions dealing with inappropriate behavior of staff, they usually present you with 4 common options. They will ask you whether you tell the supervisor, whether you confront the staff and take over immediately, whether you will wait and then talk to the staff later, and then whether you should just ignore the behavior and probably document it. Above all these 4 options they will give you, there's one you never do, and that is ignore the staff or probably just document it. Even though you document every incident, but never overlook inappropriate behavior by staff. You have to do something. So if you choose that one, it is entirely wrong. In attending to such questions, there are a few things you need to determine. First, you need to ask yourself, is what the staff doing illegal? If it is illegal, you need to report it to the supervisor or the authority. If what they are doing is not illegal, but simply put the life of a staff or a patient at risk, you need to take over the situation in order to salvage the situation. By this, I mean if they are probably engaging in malpractice. Number 3, determine if what the staff is both illegal and also put the life of a patient or a staff at a risk of immediate physical or psychological harm. Then you do the 2. You take over the situation and also report it. Lastly, if what they are doing is not illegal and does not put the life of any patient or a staff in harm's way, there's no rush, no hurry. You can wait and talk to the staff privately. And then you're going to see the example later.
My name is Jennifer. To recap the third point raised by Kenneth, if the behavior is both illegal and threatens someone's, then you must stop the staff, take over and also report it. Remember to document any incident that happened while you were on duty. It doesn't hurt. But if you fail to document, it might put you in trouble. Note that the main reason you must report and document every illegal incident is to protect yourself and your license, and also to make room for correction. Remember that you may also be presented with inappropriate behavior of patients. For instance, if you found 2 patients having sex in the room, close the door for them to provide privacy for them. But if it is a sex with a minor, you must report it. Moreover, In case of rape in the room, whether adult or minor, you must intervene by calling the security immediately, report and document the incident.
Here are a few other examples to guide you. If you notice the following situations, report them because they might be illegal activities. A doctor often prescribes narcotics for all patients and offering to help with administration or requesting for the patient to be sent down to office with narcotics to be administered during procedure. A doctor or a nurse comes out of the medication room and swallows a pill. A colleague is always going home with a bulging pocket. Also, the following 3 examples are few instances when you should simply talk to the staff privately. A colleague consistently refers to paracentesis as thoracentesis whenever she gives a report. You notice that a colleague has been coming late to work recently. A colleague often leaves her workplace unkempt.
Lastly, here are other few instances when you must confront the staff and take over. An orientee attempting to give an intramuscular-only medication through intravenous route, a colleague performing central line dressing without gloves, or a surgeon accidentally contaminated his hands during surgery and wanted to continue. Here you can't take over because you are not a surgeon, so you must call his attention immediately. The list is uncountable, but apply good judgment in tackling questions.
Please follow us on Facebook and YouTube for more. Also be informed that you can win huge prizes when you answer questions correctly on our page. You can also win between 3,000 and 50,000 Naira when you consistently share our posts, even when you did not answer questions correctly. Come, let's get our brain activated.